everyone, I am the nurse Doc Tutor Asia, and the skill we will be going over today is wound irrigation, and we're just going to do a wet to dry dressing change after that. All right, so what all will you need? You will need a wound care tray. You will also need a 60cc syringe, and preferably, hopefully you have the one with the long tip right here. This is good for irrigation. And then you would need some sterile saline, and then you would need just a little tongue right here to help you, get your dressing out there, but this may be in your kit as well. All right, so first what we're going to do is we're going to provide hand hygiene. So really quick, what is the point of irrigating a wound? And irrigation is just us cleaning the wound. That's all we're basically doing, is cleaning the wound. So provide hand hygiene, put on our gloves. And I would suggest you bring 2 sets of gloves, because once we take these, we will take these gloves off after we take the dressing off. All right. So we got our gloves on. So now let's take the dressing off. So when we take the dressing off, we want to look at the drainage that is on the dressing, and we want to assess it. So I'm going to say that this is moderate purulent drainage. So we know that purulent drainage is maybe a sign of an infection, and that's that yellowish pus type drainage, which we have here. So I'm going to document that. And then also I am smelling the wound. I'm not putting my face down in it, but I'm also smelling. Do I smell an odor from the wound? And I don't smell anything. So what I'm going to do is I'm going to take my little tweezers here, and before I actually remove the packing in the wound, I'm going to assess around the wound. So around this area right here, I'm going to see how the peri area looks. So it looks like that is dry and intact. I do see some redness around here, so I want to make sure that I am doing my dressing changes as ordered, or PRN as needed, so we won't have any skin breakdown around the wound. So you always want to make sure that you're assessing around the wound. Now we're able to take our old dressings out, and then we also just want to make sure that we are assessing there as well. So we got a bunch of purulent drainage on here. So once we get out the packings, now we can assess inside the wound. So we want to be looking in the wound. We want to be measuring the length, and the depth of it, because you can take a little ruler and you can just measure it out just to see if the wound is actually healing. But I'm looking at the tissue inside of it. I see that pink, moist, red tissue, so that lets me know that this wound is healthy. All right, so after I've done this right here, if this right here is the abdomen right here, what I would have the patient do, I would have the patient lay on their side, so when I start to do the wound irrigation, that the fluid can then fall out. But get a chuck pad to lay under your patient, just because you don't want to be wetting everything up. So you want to go ahead and discard these gloves right here. You want to perform hand hygiene and just put on another pair of clean gloves. So all right, so I have my sterile normal saline right here. So rule is always, anytime you are opening a sterile solution for the first time, or any times after that, you want to pour a little bit out. And it says that there's a bacterial layer or something on there, but that's what I just do, just pour a little bit out. So what I want to do is I'm going to take this right here, and I'm just going to put it in here, and then I'm going to draw up some. So this is a big wound right here, so I may draw up the whole 60 cc's. All right, so once you got your fluid in here, now I'm actually going to turn the patient to the side, because I actually can. So what you're going to do, you're going to just go up here, and then we're just going to irrigate, pushing here slowly. And we're going to allow it to drain out. So we're just going to clean, we're just going to push, we're going to move down the wound, and we're going to move down the wound, and we want to continue to irrigate until we get clear fluid. So until your drainage is then clear. So you want to keep on irrigating. So irrigate, irrigate, irrigate. All right. So we now see that our drainage is now clean, so our wound is now considered clean. All right, so next what we want to do is we want to get some gauze pads. So we're going to use some gauze pads, and we're going to do that just to dry the area. You may have to do this a couple times so you can get your wound nice and dry. So you then want to get another clean piece, and then you also want to just damp it inside the wound to dry the wound out. So it's up to you if you like using these tweezers and things like that. I don't think that you have to use them. It's all up to your preference. Sometimes I just take especially since it's not sterile, I just take this and I just go in the wound and I'll just damp it right here and I'll dry it. All right. So now that we see that the wound is nice and clean and dry, we now can follow the physician's orders. So I'm going to go ahead and I'm going to look in my kit and see what all I have. So I have a abdominal pad right here, and then I also have some gauze and some tape. So it is a wet to dry dress. The only thing that I'm going to do is I'm going to take my, since it is a wet to dry dressing, I'm just going to take some saline and I'm just going to pour it on there. And then I'm just going to wring it out. So you just wring it out on there. I'm going to try to like fold it like how the wound is shaped. So the wound is shaped like this. So I'm going to fold it like this, okay? All right. So we're going to then place this one in there. And like I said, it's up to you if you want to take it and use your little tweezers. It's up to you. One of the biggest things is you always want to make sure that the dressing, especially if it's wet, you know, we want to make sure that it actually just stays in the wound, that is not touching the skin, because we don't want any moisture on the skin causing skin breakdown. So after we got the wound covered, we now can put our abdominal pad on it. So before you put the abdominal pad on the patient, what you can do now, you can just go ahead and write your name, time, and date on there so you would know the last time that it was changed. And then you would just place this over the wound. You would take your tape and you would just take the 4 sides of the wound. You also want to make sure that you confirm if your patient has any allergies to tape. So there you have it, you guys. We just did a wet to dry dressing change, and we also irrigated the wound. I hope you guys learned a lot. Thanks for watching.